When taking a person's blood pressure, there are a few pre-assessment protocols to follow. First, you want to be sure the person has been resting with feet flat on the floor, a back support, and arm resting at heart level for at least 5 minutes. You also want to make sure blood pressure measurement is taken on the left arm, which should be bare. Therefore, if a person is wearing sleeves or a jacket, the subject should be instructed to remove the jacket or lift sleeves. Instruct the person not to intake caffeine or nicotine at least 30 minutes prior to the assessment. Proper cuff size should be used to ensure accurate measurement. The bladder within the cuff should be encircled at least 80% of the upper arm, and when placing the cuff, you want to align artery mark with the brachial artery. Ensure stethoscope ear prongs face forward. Place bell of the stethoscope over the brachial artery. You want to be sure to turn the valve to the right. Inflate to 180 milliliters of mercury or 20 above first Korsakoff sound. Next, you want to turn the valve to the left to release at a rate of 2 to 5 millimeters of mercury per second. Systolic blood pressure is the point at which you hear the first strong Korsakoff sound, and diastolic blood pressure is the point before the disappearance of the Korsakoff sound. Next, the person should be allowed to wait 3 to 5 minutes before blood pressure is reassessed. Normal systolic blood pressure is a value less than 120 and a diastolic value less than 80. Pre-hypertension is a systolic value between 120 and 139 or a diastolic value of 80 and 89. High blood pressure stage 1 is a value between 140 and 159 for systolic or 90 to 99 for diastolic. High blood pressure stage 2 is a systolic value higher than 160 or a diastolic value higher than 100. Hypertensive crisis is a systolic value higher than 180 or a diastolic value higher than 110. After assessing each group member's blood pressure, we observed normal range values for 4 out of 5 of the tested subjects. Subject 2, however, tested in a pre-hypertensive classification.